Well, if you're wondering what causes spider veins and if they can be fixed, the answers are here at the Vascular Institute of San Antonio. And joining me right now is registered nurse Elisabeth Gonzalez. Thank you so much for having us.
Thank you.
So tell us about the Vascular Institute of San Antonio and what you offer here.
Okay. We are a group of peripheral vascular and foot and ankle surgeons specializing in treating arteries and veins outside your brain and your heart. Out of our 12 surgeons, we have 3 of which have 60 years of combined experience treating varicose veins in an office setting.
So what causes, varicose and spider veins?
It's largely hereditary. Veins, unlike arteries, have the difficult task of carrying blood out of the legs, and because of that are very heavily dependent on valves that are mounted on the vein wall, and with the use of relaxation and contraction of muscle, pumps the blood upward. Genetic factors make these veins stretch, and the valves are no longer working like they should, causing pressure to build in the veins and causing bulging veins that distend outside the skin, and in this case of spider veins, they just become closer to the skin surface and you see them as purple and red veins.
And so when should people seek treatment?
Varicose veins are quite common. 1 in 4 people will develop some kind of varicosities in their lifetime and may never have medical issues with them. However, should you develop leg fatigue, swelling, pain, and discomfort, and especially if there's skin discoloration below the knee, it's advised that you come see one of our vascular surgeons before it turns into more complicated things such as skin breakdown and ulcers and infection and inflammation in the tissue.
And so you mentioned seeing one of the surgeons. What treatments are available?
Well, if you present with large varicose veins, an ultrasound will determine how high up in the leg these valves are no longer working like they should. And that pressure point may have to be addressed. That can be done with an introduction of a catheter through a tiny little needle hole, and we either inject a glue or we seal it with a laser inside the vein. Then subsequently we may have to remove some of the distended veins that remain down lower in your leg, or they may just be the problem you presented with originally, and those are removed through tiny little punctures in the skin that are not visible, no sutures or anything, it's just little tapes in the skin. Lastly, the very small cosmetic veins, spider veins and the green reticular veins as we call them, are done with sclerotherapy, which is an introduction of a chemical that irritates the wall of the vein and shuts it down.
And so 11 locations around town, right?
Correct.
Okay, and we are at the Hebner location?
Yes. Vein treatments are offered at our Hardy Oak Boulevard location and our Hebner location.
Okay, and registered nurse Elisabeth Gonzalez, thank you so much. For more information on the Vascular Institute of San Antonio, all you have to do is give them a call at 210-962-5709 or visit the website vascularinstitutesa.com.